Hi, it's Jane Coombs here from Working Well Solutions, and I'm here to solve some of the mysteries of the NHS in the UK. The first one is the key differences between a GP and a specialist. Let's go. A general practitioner or GP is the first person you see for almost any health concern. They are a generalist doctor, meaning they have a broad knowledge across many areas of medicine, from common colds to chronic conditions. They are your family doctor. Your family doctor or your GP is the central point of contact for all your health information through your life. They keep a comprehensive record of your health history, including reports from any specialist you've seen. This allows them to see the big picture of your health and ensure all your healthcare is coordinated. All doctors have the same basic training. However, a specialist is a doctor who has undergone extra training to become an expert in a very specific field. For example, a cardiologist deals with your heart, a dermatologist deals with your skin, or an oncologist, cancer. So let's take the cardiologist, who will focus only on your heart. They will perform specialised tests, diagnose a condition, and recommend treatment plans for that specific issue. Then they report their findings back to the GP. So, to summarise, your GP is the central controller of your healthcare and recorder, and your specialist looks after bits of you. You can have many specialists, one for each condition. For example, the cardiologist looking after your heart and rheumatologist looking after your arthritis. But you will only have one GP who oversees all the specialists and coordinates your care. So how do you get to see a specialist or a consultant? The GP's role is to assess your condition first and determine if a specialist expertise is needed. They act as a gatekeeper to the more specialised and often more expensive levels of healthcare. However, nowadays you can ask to go privately and phone up your local clinic or hospital for quotes and appointments. Once the specialist has diagnosed and or treated the condition and you've had follow-up appointments if necessary, the ongoing management often goes back to the GP. For example, a specialist might prescribe a new medication, but your GP will be the one who manages the repeat prescriptions and monitors your long-term progress. So there you have the 7 differences between a GP and a specialist, and how the two types of doctors work together to provide a coordinated specialist care for you.